Hello, my dear friends. I'm Maxim Volkov, the head of Grand Secret. Today I'm going to share another cool trick that you can use regardless of the techniques you usually apply. I often see how young, not highly experienced massage therapists give massages, and I believe that they have a problem with friction. The way they do friction is not what a person being massaged wants to get. I know this myself based on the massages I received. What is the main problem or weakness of the friction inexperienced massage therapists usually provide? They do little friction all over the body, very fast and unclear. Guys, this is wrong. Let's speak about the classic massage. According to the definition, the friction means shifting of the subcutaneous tissue and fasciae, and it shouldn't be applied for more than 10 seconds to one and the same area. But it means that it is not a problem if you do it for 10 seconds, you see? So when you work, please, focus on a specific bone. This is the iliac bone and the iliac crest, and later I will show you how to do friction of the shoulder blade. You need to keep in mind that the iliac crest is a place of attachment of many muscles, and we need to apply friction exactly to this place. Because the purpose of friction is to increase the blood flow to this area to the maximum extent. If you increase the blood flow to tendons and fasciae, their overall condition becomes better. Sometimes massage therapists do it in a wrong way, because they do little friction here, little friction there, and, as soon as the skin reddens, they think it's time to do the pushing and then switch to the kneading. No way. Friction is a specific and thorough preparation of muscle attachment places. So where are muscles attached to? This is the iliac bone, the shoulder blade. Let's start with the iliac bone and do the sawing. You do it all over the back at a good speed to warm up the surface layer of skin. But now you need to switch to the friction, which will be applied locally. You can apply friction to one and the same area for 10 seconds, it's not a problem. So you have done it here and move on to another area. The person being massaged should even feel that it's enough of this technique here and will even want you to move on to another area. It means that the nervous system of this person has already received enough signals and will now spur a very good blood flow, meaning that the arterial blood now starts entering the muscle attachment place to the maximum extent. Then take a break, so if you do such deep friction on the specific area, you'll receive this kind of effect. After that you do some slow pushing and then you can change the technique. Let's do the ringing, for example. Here we have the side of the body and we do it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and again we do the slow pushing. So now the skin receptors need some rest, meaning that you should do the pushing and then the thorough and slow stroking. The same thing is to be done to the shoulder blade. First, you need to warm it up, so let's do the same sawing. The upper edge of the scapula, the medial edge is ready, and the lateral edge. You make slight and quite quick movements, and after each friction you do the pushing. Firstly, to calm the skin, and secondly, to increase the lymph flow. And now you continue working. Let's do the focused friction with the thumb, for example. So, while working, you might find indurated tissue or painful or swollen knots somewhere at the muscle attachments. You need to do the friction right at these points. What does it mean? It means you need to apply the focused friction with the thumb for 10 seconds to one particular point. Good, then you do the pushing. You don't need to do the focused friction over the entire shoulder blade, but only at the points where you feel knots on the bone surface. Here, for example, I again feel the knot. If I now do a deeper friction or compression, the client will feel pain. Why? Because this is the muscle attachment place, and in most cases the muscle is in contracted state and, of course, it pulls the tendon, and that is why the person feels pain here in this area and you perceive this problem as a tight knot. Here you find such a knot again and start massaging it. Don't move to any other place, massage it through till the end. You can start doing slight friction and then, on the 7th, 8th, 9th and 10th time you do the deeper friction. That's how you should massage all the areas of muscle attachments. Nobody cancels the overall friction. You still can do it, and sawing and ringing. This is all very good. But pushing up and straight line friction need to be focused. In this case you will get a greater effect and what is more interesting. Later you can do softer and slighter kneading, without pressing too much, but your client will remember this massage session as the dynamic, powerful and comprehensive massage. This is the main point of such small changes in your work. Massage therapists with many years of experience, for sure, have already intuitively understood that they need to deeply massage all problem areas, applying friction. And those who are just at the beginning of their career path, please, include these tricks in massages you give and you'll see a great change in your client's attitude towards you and your work. So, be the best in what you do. Soon we will shoot new videos about other interesting tips and tricks. See you.